Hello there, my name is Janice Mitchell and I'm a pelvic floor physical therapist. I'm really excited to share a technique with you today called the perineal massage. Perineal massage may be helpful at reducing tearing of the perineum during labor and delivery. Perineal massage is also something that I use with my patients with pelvic pain, including pain during intercourse, scarring of the perineum, whether it be after childbirth, after surgery, trauma, or other disease-related processes. It's also effective at helping to relax or release the tension in the pelvic floor muscles for those that may have difficulty with letting go or releasing all the way. I hope that you find this information helpful. This is my first video. I'm nervous, but thank you for joining me. Let's go over pelvic anatomy. So this pelvis is situated as if it were mine. You have the pubic bone in the front and the tailbone in the back with the spine. Here's a view from below, so you can see the pubic bone and the tailbone, and you have 3 exit canals. Here's the urethral canal for urine, the vaginal canal for sex and childbirth, and the rectal canal for liquid waste, solid waste, and gas. You can see the pelvic floor muscles attach all the way up to the pubic bone and come back to the tailbone. They also stretch side to side, so literally this layer of muscles here, you have several layers, and it forms the floor of the pelvis. Now let's open up the pelvis and look inside. Here we have the tailbone in the back with the spine going up, and here's the pubic bone. This is the bladder and the urethral canal, the uterus and the vaginal canal, and then the rectum and the anal canal. The very important part here to review is the perineum. So the perineum is this area of tissue right here in between the vaginal opening and the rectal opening. Before we proceed, let's go over a few precautions today. If you have any open lesions, stitches, incisions that haven't healed, or cancer in the pelvic or abdominal region, do not do this. If you are pregnant, get clearance from your healthcare provider first to be safe. If you have any other medical or skin condition that may be worsened by this, do not do this. This demonstration is not intended to replace medical advice. Please consult with your healthcare provider first. Privacy is very important for the perineal massage. So make sure that you have your door closed, locked if possible. Let's close the blinds if you have windows. And now you're ready for the next step. The next step is to prepare. So number 1, you want to make sure that your hands are clean and that your nails are short and smooth. Next step, you want to relax as much as possible. So if you have a candle, light a candle. You can use different types of oil. We have coconut oil, almond oil, Vaseline, and then you're going to turn on the water. So we like to have a nice, warm bath for the perineal massage. The next step is position. So a bathtub is a great place for a perineal massage because you have the warm water, which helps to relax tight muscles, and then you have the support of the bathtub. So let's just demonstrate how a bathtub is supportive. So you get in the bathtub, sit down, slide back, lean back, and then you have your legs leaning against either side of the bathtub. Just like other muscles, soft tissue, and scars can be massaged and mobilized, so can the pelvic floor and perineum. So we're going to pretend like the webbed space of my hand is the perineum. Here, this is the vulva and the vaginal opening, and this is the anus, okay? So you're gonna take a lubricated finger and just gently, I want you to touch the perineum, and you're going to just gently press in, okay? And then you're going to move side to side, move up and down. I want you to move in diagonal directions. And listen to your body. So if you can press a little bit deeper, go a little bit deeper. So press in, press side to side, go up, go down, go diagonal in one direction and diagonal in the other direction. To advance the perineal massage, basically you're going to take your finger or your thumb, based on how your anatomy is and what you're most comfortable with. I'm going to use my finger for demonstrations. And you're going to place your finger or thumb on the perineum, and then you just drop your finger or thumb into the vaginal opening. And so what you can do initially is just do a sustained, gentle hold, where you're just gently pressing down towards the rectum. And you can hold that 15 to 30 seconds. And again, listen to your body. Then you can move to the side, and you're pushing more at a diagonal angle here, but still it's just a sustained, gentle hold. And then you can go to the other side, a sustained, gentle hold. Next, you can actually do like a sweeping motion where you're gently sweeping your fingers side to side like a U. And let your body be your guide. So start off very gently, but if you can tolerate a deeper sustained pressure, do that at your tolerance. So you're just stretching back and forth. And then the last technique here, a lot of times there's scarring here at this part of the perineum. And so you can take your finger and thumb and actually grasp that scar, and you can roll it between your fingers. You can push up and down, side to side, and you're working the length of that scar. Again, remember, you're going very gently at the beginning, listening to your body, and then as you can tolerate it, you're doing increased pressure and stretch. The last technique that I'm going to go over here is scar massage, where you're going to drop that finger into the vaginal opening, grasp the perineum in between your finger and thumb. This area of the perineum is an area where there's frequently scars due to either episiotomy or tearing. And so we want to gently start working that scar so that it has mobility and flexibility and can stretch when it needs to. So you're going to grasp it and slowly roll it between your fingers. And then you can go side to side where you're working the length of the scar. You can go up and down, diagonal. And you're just listening to your body, working the scar, massaging the tissue, and trying to increase the flexibility and the mobility here. In terms of frequency with the perineal massage, let your body guide you. You may only be able to start off at a minute or two every other day or every third day, and then gradually work up and increase your time and increase your frequency. Perineal massage is using the same techniques and concepts that we use in other areas of the body to massage and mobilize soft tissue, and we're applying that to the pelvic floor muscles and the perineum and surrounding structures there. I hope that you have found this information helpful. It's been a great time to share this with you, and I look forward to working with you more in the future.